Hello, everyone. Welcome to today's edition of COVID Decode, where we here at ThePrint have experts live on air to take your questions on COVID and answer some of the most common and pressing doubts that people have at this stage of the third wave. Today, we have with us two guests, Dr. JVR Prasad Rao. He's the former Union Health Secretary to the Government of India and then the Special Advisor to UN/AIDS. He's worked extensively in HIV/AIDS policies and strategies, and currently he's also a member of the National COVID Task Force. Also joining us is Dr. MC Mishra, the former director of AIIMS, who played a key role in the creation of the AIIMS Trauma Care Center. He's also the former head of surgery there, and he was among the earliest experts in the country who said that India is in community transmission. Along with our guest is our in-house expert as well, Abantika Ghosh, who's been doing some stellar COVID coverage in India. And I'm your host today, Sandhya Ramesh. Welcome, Dr. Mishra and Dr. Rao. Now, as we know, the third wave is surging through the country, and many other countries around the world are also in either a COVID wave, or some are even past their peak of Omicron. It invades rapidly, and thus we expect that it might also drop off rapidly. But now with Omicron, since so many people are doing home testing, how effective is the test, track, and treat method, and how well is it being followed? Dr. Rao, could we start off with you? Could you shed some light on how tracking is happening currently as compared to the previous waves? And if we're missing something that we should be doing in terms of just tracking the progress of the virus as it moves through the population?
I think the tracking strategy appears to be the same, more or less, as what we saw in the second wave. Even though the numbers sometimes are less, I think we tested a lot more people in the second wave than now. Because I think there is a feeling, I think Dr. Mishra, of course, is an expert in that, but I can say that just random testing is not going to help track this particular variant, because it is highly transmissible and contagious, almost like measles. So chasing this by testing is not really going to help, especially when you are not going to treat everyone who is going to be tested positive, because there are many cases which are asymptomatic, and the entire spectrum, starting from asymptomatic to serious cases, you find in Omicron. So the real message here should be to the state governments that look for serious cases, look for symptomatic cases, and see that your preparedness, the health system preparedness, is adequate, and you are not caught off guard like what we had in the last second wave, so that you can take care of the serious cases. Otherwise, routine testing, at least in the case of Omicron, is not going to really help. But we must test people, because you also should know what is the positivity rate. Today, more than the numbers, I think the real indicator is the positivity rate. And that rate has suddenly shot up from almost 0.5% to about 15, 20, even 30% sometimes. That has to come down. So really, to get a control over the epidemic, you have to have that as the monitoring indicator, not just the total number of people who are infected. Because if you have 30% positivity rate, even if you test 10,000 people, it is not those 3,000 which are infected. There are many more. So you can never get a good estimate of the total number of people just by testing a few. So, but the percentage is very, very important in this case.
Dr. Mishra, would you like to add anything to that right now? How well are we testing, and what do you think about tracking and all of the following procedures?
I think, Sandhya, there is no point in putting our resources for tracking, tracing now. It won't serve any purpose. And testing, symptomatic, if you wish, you can get it done, or otherwise you presume that it could be COVID. Isolate yourself at home. And this is something which I've been advising. If somebody is calling me from one family, we have some close people who contacted me, and one person got the symptoms. He got himself tested. Then his wife had symptoms. Then his son had symptoms. So he was asking, should we get the test done? I said, it's up to you. If you want, you can get it done. Otherwise, presume that it is COVID and just stay put at home. Take care of your diet. Take care of your fluid intake. Take paracetamol to bring down the temperature. Take rest. And they all got all right in 3 to 5 days. So this is the spectrum this time. What we are noticing, we have not been prescribing the same medications which we were during the Delta variant phase, that ivermectin, hydroxychloroquine, antibiotics, doxycycline, and all that. As Dr. Rao said, very important, we must focus on those who are coming into the hospital with this problem. And because some of them might be still infected with Delta variant, may not be Omicron. So that differentiation has to be made, and which cannot be made clinically. That only can be made on clinical course, because genomic sequencing forthwith is not available. You can't do the genomic sequencing, and RT-PCR doesn't tell you whether it's Omicron, whether it's Delta, it is Alpha, or any other virus. I'll give you one example quickly and then stop. We were in USA and we just returned on Tuesday. We had gone to see our grandchildren, and our 4-month-old grandchild, he developed fever. So when he was taken to emergency department, they did run a viral marker, and it turned out to be influenza A. Now, so in USA, they are doing it. Did we ever bother here to do influenza test? Any one of us? We were still getting the infection. We were infecting others. We were never putting on mask on ourselves. That has been going on for years. It never occurred to us to get even vaccine against flu shot, what we call. So I think that is where we are with Omicron. But those who are getting admitted, for sure, and even those hospitalizations also, even in US, this was the talk that what they said, suddenly there is a jump in children were getting admitted, but they were getting admitted not for COVID. They were coming from some other problem, and they were tested. COVID was also there. And the same thing is happening in India also right now. If you look at the hospital where I go, there are hardly any patient of COVID admitted currently. Similarly, in other hospitals also, like AIMS, I was talking to someone, they have close to, say, 200 patients, but majority of them are mild, but they came for some other purpose, like somebody had trauma, somebody had some other problem. So they came, and when they were tested, they also had COVID. So that is the kind of situation we are in. So let's put our resources where they can be utilized much more than tracking is just not possible. Tracing just not possible. It is so much community transmission is there. It won't, because you will not know who gave you, where you met someone, where you caught it. So just what I would say broadly, any symptoms of upper respiratory tract infection, fortunately, lungs are not getting affected. Any sore throat, any cough, any fever, mild or moderate, consider it is COVID till proved otherwise. And if you are worried, get yourself tested. If you are not too much worried that it will be okay, just rest at home and take other measures.
Thank you, Dr. Mishra. I actually want to extend that question a little bit and ask you a follow-up. We know that now, since so many people are vaccinated, most cases of COVID are described as mild, except for, of course, people with serious comorbidities. But the word mild is a bit of an understatement. No, can you please tell us, in terms of trauma to the body, what mild cases can do, and what you have come across in your work in terms of people who've been hospitalized for COVID? How has it been different in this way, the few cases that you've had, if you've had any, as compared to the previous ones?
Actually, people, those who had little symptom like sore throat and some fever, which was not high grade, which is low grade, the 100 that Dr. Saab, it goes to 100, 101, and then I take paracetamol, it comes down. And now there is 99, and this is about 3rd day, 4th day onwards. So that is what is the pattern as of now of this. As I mentioned, that in hospital, particularly those who are going to the hospital, they are going for, say, if there is a trauma, they have to go. If somebody is pregnant, they have to go. So 33% women who are pregnant turned out to be positive. So that is how it is community transmission. But they have gone for antenatal checkup or delivery or something else. but not for COVID. They did not get hospitalized for COVID. So that we must understand. But on the same hand, what we would say, if your saturation is the key here, and that would indicate the involvement of the lungs, and that would indicate that it may not be Omicron, it may be Delta, it may be maybe Alpha. So in that case, what we are still asking people to monitor their oxygen saturation. And it has been okay with most people. And like somebody told me that I have gone to walk, I have resumed my yoga on 5th day, 6th day, and I am feeling okay. So I think it's variable. So some people may have more fatigue or muscle ache or myalgias. Some people will have less. So I think it's an individual variation, which is always there in any illness, that somebody will feel more like, even in Delta variant, one of my wife's cousin, she got it. She's an anesthesiologist, critical care person. And she said, so much weakness I have never experienced in my life. On the other hand, in Delta variant also, most people came out all right. They didn't have much problems, 85 to 90% people. So I think it is comorbidities is the key. Age is another risk factor for all of us. Surely, if somebody is diabetic and not controlled, they are more likely to get disease getting worse. And that was the pattern in all the waves so far, what we have seen.
And also, thanks to vaccination, the hospitalization rates have come down quite drastically in this way. Yeah, otherwise it might not, it might have been a rehash of wave 2. But Abantika, speaking of hospitalizations, can you tell us during the course of your reporting, what has it looked like in the third wave when it comes specifically to hospitalizations as compared to the previous 2 waves? What is the data looking like?
Right. So as per yesterday's, I'm looking at the Delhi numbers, yesterday's Delhi numbers. So the vacancy position is, depending on which level of bed we are talking about, it's anything between 83% to 95%. That's the number of vacant beds that are available. In Calcutta, I believe of about 34,000 beds, not more than 4,000, 5,000 are occupied. Maharashtra is again, it's quite low. In fact, they are opening schools from today. They have opened schools. So the hospitalization numbers are looking good, and that is partly why many experts are now saying also the curve is looking like it's coming down in most of these major cities, Delhi, Bombay, Calcutta. So to that extent, maybe it looks like we are on the downside. Yesterday, Delhi recorded less than 10,000 cases after quite a long time. The positivity was also about 12-13%. So I think we do seem to be coming down. It may be a little too early to say that this is over, because as we have seen with this virus, one big super spreader event is all it takes to just take it to various corners. I mean, we've seen it multiple times. Maybe we should not yet declare that this wave is over in these major cities, but it does look good at this point of time. Yes.
Yes, Dr. Rao.
Yeah, what Abantika says is true. It may be coming down, but I think there are 2 important issues we need to bear in mind. One is the entire spectrum of infectivity, starting from asymptomatic right up to serious case, you get an Omicron. So this popular belief that Omicron is mild is not correct. There could be very serious Omicron cases also leading to hospitalization and even death. So that need to be factored into, especially in terms of the health system preparedness. So the health system preparedness has to be in top gear, as in the case of the Delta in last year. Second point is, the data coming from state shows that the percentage of Delta cases are still there substantially, maybe 10 to 20%. In fact, in some states, as many as 20% of the cases are Delta cases. That means those cases can also end up in hospitals at some point of time, substantial number. So when the numbers are large, in terms of 3 lakhs or 4 lakhs infections a day, you can still see a large number of people thronging to hospitals with serious illnesses. So I think the health system, in terms of the preparation, oxygen availability, ICU beds, all of them, I think need to be in top gear. The second point is, this COVID wards, separate wards for COVID patients, has created another problem. Because the moment a person is admitted with COVID, even though that person has severe comorbidities, people are not willing to go to that ward to treat those people. So in the process, what is happening is, the people with comorbidities should actually get the top quality care than the COVID illness. But because they are put in a COVID ward, the best specialist care, I mean, in fact, we have cases in Calcutta. I had that specialist not going to treat those people. So that is where the mortality also is coming up in some cases. So I think we need to be very careful about segregation of COVID wards and seeing that specialist quality care is available to those patients who are there because of comorbidities, not just because of COVID. I think this is very important. The third point is, when you have a large scale transmission like what is happening in India, there is always this possibility of the virus mutating again. So this constant genome sequencing, which is now being done, I think, through a network of labs, must continue. I think scientists must keep a very close look at the possibility of any other new variant emerging. God forbid it should not, but if it comes, I think there has to be again a proper analysis to see whether it is a more serious variant or whether it is a mild one like Omicron. So it can come from outside the country also. That constant vigilance for emergence of new variants is also very much necessary.
Right.
Thank you, Dr. Rao. I think Abantika has a follow-up question.
So Rao sir made a very important point that, we have these COVID wards and non-COVID wards, and doctors, in fact, a friend of mine was just telling me the other day, doctors are reluctant to go in and check on patients there. Now, what I wanted to ask Dr. Mishra is that Fraser Health in British Columbia, they have recently given out an order that COVID and non-COVID patients should be kept in the same wards. We should not differentiate anymore, given that we are in community transmission, given that this seems to be going on. I mean, this may be going on for a while now. Do you think it's a good idea, sir?
I think it's a good idea. I think it's a good idea because that problem has been highlighted in various hospitals also. That as soon as I've been operated for something, as soon as I've been tested for, not for symptom, but just because it's a routine testing, which is ongoing. And on that, if you find COVID positive and you put me in the separate ward. So I think it's a good idea because most of the healthcare professionals have been vaccinated. They must take all precautions when they visit the patients anyway. Maintaining distance and all those PPE kits or masks in high-risk areas like ward and ICUs. So I think that those things, those protocols can be made more stringent and that way. And I agree with Dr. Rao that this is a problem that you shift these patients and then these patients are not getting optimal care. So that's something which I would endorse. And the other thing, what I would say that preparedness is already there for third wave, because most of the hospitals which were designated for COVID care hospitals have not been denotified for the same reason, because we didn't know when it will come. We were waiting for this since August. Somebody said July, somebody said August, September, October, November, December. So it came in December, started in January. And basically the prediction by on the basis of mathematical calculations by IIT Kanpur, IIT Madras, I think they feel that mid-February would be the time when we will see the decline, peak going up. Because right now what Abantika, you said, it is flattening actually. It's not coming down. The curve is flattening. So it still has to come down, and that too in big metropolitan cities, it has shown some indications, but it can go up very quickly. Like in USA, when I was there, 24 hours, they had 1 million plus infections, but naturally their testing is also quite large. And then they had even more than that, 1.5 million cases in a single 24 hours. They crossed 500,000. Like in India, I don't think very many people are getting the test now. Since the symptoms are mild, they are putting at home, and that is it. So there may be large number of infections. What we are looking at 10,000 or 9,000 in Delhi could be any number. That's kind of a wild. Anybody can have a wild guess on that, because our density of population, the way people live in small houses, number of people, the chances of the people getting community transmission is very high, and that is the reason for community transmission. Basically, you can't pinpoint that where did I get this infection. So as Dr. Rao clearly mentioned, and I also mentioned that before, that along with Omicron, Delta has not disappeared. So Delta is very much around. So who will get, because one of our faculty colleague at AIMS, her mother in Chennai, she had Delta recently. She is there. She is the head of anesthesia at AIMS. So I just called her. So she said, I'm in Chennai with my mother, 80-year-old mother. She had Delta. She required some ICU care. Fortunately, no ventilator was needed, and she was recovering. So Delta is very much there. Percentage wise, we will only know if we do large number of genomic sequencing, which is actually it is required in large number and on a continuous basis to know what is happening, which way we are going, and that will basically give us some clue what should we do and how should we go for the measures in the family, in the at workplace, whether the school should be opened or how we can allow more free movement. But I think the most important thing, people will still, they need to observe COVID appropriate behavior. That is, there is no I think, alternative for that, irrespective of vaccination status, irrespective of age. And I think that is something which will prevent, and even if it happens, even if we contract the illness, it will be milder because less virus particle will inhale. So I think that is something which is desirable from everyone.
And this is going to be the way of life for a while, it looks like.
It should be the way of life,
Because ultimately in a hospital setup, universal precautions are important. Whatever may be the case, whether it's the COVID case or a HIV case or some other infective case, doctors and nursing staff and paramedical staff, they all need to observe universal precautions. That is done, then there's no need to have a separate branding like a COVID ward or some other ward, etc. That is the main issue.
This actually incidentally also brings me now to our viewer questions. Our first question is on endemicity. There are actually two questions, and I think I would like to club them both together. The first is from Anand Jalvi. He says, shall we assume this Omicron variant slowly is going to change as a common cold and cough and would end this pandemic? And the next is from Soumya Depre, who says, can we consider Omicron as an end to the pandemic? So the question is, I guess, how do we identify when it is time for endemicity, when we know that the virus is going to become endemic? Dr. Rao, could you take that, given your work with community medicine?
Well, you see, the question is, one's guess is as good as the others. Because till the time a new variant emerges in the field, you can always say that, yes, after it completes its cycle, it will become endemic and then it will come down. We all thought about Delta the same way. When it has come down, okay, Delta is over, now the cases will come down. Suddenly you have this Omicron coming in. Today, Omicron is overwhelming every other variant. So where is the guarantee that another variant doesn't emerge? So the already people are talking about end game, etc. I think it is too early to say that. It's too early to say that. We need to watch the behavior for at least another couple of months. This Omicron has to come down. And by the time, if suppose no new variant emerges on the scene, then we can say, okay, slowly it is going to come down. But if you look at the world population and the degree of vaccination that is happening, you find this serious imbalance between the developed world and the developing countries. If you look at Africa, 5 to 10% is the rate of vaccination. We are fortunate in India that we have such a great vaccination program that I would say we should commend the government for taking it as a large scale and free of cost to people. But whereas many of the African nations are still at the rate of 5 to 10% vaccination. So if some variant emerges, like what happened in the case of Omicron in Africa, it is a matter of time that it will emerge, come into other parts of the world also. So I think it's too early to talk about end games and endemicity. We need to still watch the situation. It's still very fluid, and we need to take the maximum precautions, as Dr. Mishra has mentioned. There's no other alternative to this. The mask, safe distancing. Ultimately, primary prevention is the ultimate answer to this.
Yeah, and especially like you mentioned with vaccine inequity, we know that the virus mutates in people who are immunocompromised, who have chronic illness. And we also know that that's how Omicron came. It didn't come from Delta, it came from the original variant of the virus, and it evolved in some immunocompromised patient over time and then came out as Omicron. So vaccine inequity is a really big problem, and we need to tackle that if we have to bring down COVID cases in waves around the world. Dr. Mishra, I wanted to ask you, we keep hearing of long COVID and people experiencing symptoms for months on end. A lot of these symptoms seem to be neurological, including things like loss of attention, loss of focus, and brain fog. And then we also have the typical fatigue and shortness of breath. So when people experience these things after they've suspected a COVID infection or have had a COVID infection, what should they do? Does it make any sense to get themselves tested anywhere and diagnose and confirm that it's because of COVID? Or is it just wait and watch for now because we just don't have enough information?
Yeah, that's a very pertinent point. This happens to people who have severe disease and they get into high dependency units and intensive care units. And because this virus can affect any system of the body, from brain to lungs, to heart, to liver, to kidney, to muscles. And that's the reason these all symptoms, cognitive impairments or loss of smell, loss of taste, GI, gastrointestinal symptoms in terms of abdominal pain, vomiting, diarrhea. Fortunately, in second wave, we considered, on the basis of whatever information we had, that loss of smell and GI symptoms was a happy news, because most of these individuals did not fall severely sick. The disease was milder, even in Delta variant. And the brain fog, definitely it's a cognitive impairment if there is a central nervous system involvement. Cardiomyopathies, sudden deaths have been reported, but predominantly it's a respiratory virus. So it affects the lung and lung capacity, particularly in those who already have a pre-existing lung problem, bronchial asthma, or they have been having some problem, or they were put on ventilator or high flow nasal oxygen. It leads to inflammation, leads to fibrosis. So there was a lot of discussion the other day. There was a grand round webinar organized by AIMS on this topic. And there were that preventive medicines, should one give preventive like steroid to reduce the chances of the lung fibrosis, etc. But the main thing I would say, this is my favorite topic to talk, our own basically methods like pranayams, the deep breathing exercises, yoga, can help a great deal in increase in lung capacity. And this is what we kept pushing for people at home, in hospital also. That was, they were advised that proning, awake proning was used extensively in Delta variant to keep the lungs expanded and improve the oxygenation. And the same thing people can do at home, these breathing exercise, pranayams. As a matter of routine, they should do it. So when they have a problem, they can do it much better. And that is something what we emphasize quite a lot. A lot of people actually came out. I dissuaded quite a good number of those who approached me going to hospital in even the Delta variant wave. I said, please don't go to hospital. You just do these measures. And they all thanked me afterwards because it was more of a panic rather than anything else. I said, you will not be better off in hospital. I can tell you that, whatever information I have, because there is no one with you there. And doctors are doing rounds on the virtual. Some nurse will come maybe once or twice while you are admitted there. So there is no one, and people did go into a lot of psychological issues, depression while in hospital because they couldn't talk to anyone. And so I actually dissuaded a lot of people going to hospital in second wave. So long COVID is a distinct problem in some, and there is now special clinics in most hospitals. In AIMS actually has established a clinic, post-COVID clinic, where people can go and take advice what is to be done. But I think largely I would say, since it is related to lung, people can do on their own. They can build this confidence, and they should not get panicky, and they should not get depressed. I think that is something which is very, very important for recovery, even if somebody has a moderate disease, and even if somebody is with severe disease admitted in hospital. That is something. Regarding endemicity, my take is that this virus is not going to go anywhere. We should not get this impression this virus will go away. It will remain within us, within the community. People will get vaccinated, people will get natural infection, will get immunity, like we have all other viruses around. If somebody gets a little bit immunity down, they get herpes infection, they get chickenpox, even today, even those who have been vaccinated long ago, and also other viral infections are prevalent in the air. There are only problem with Delta variant was because it was predominantly affecting the lungs. I think that created a lot of problem otherwise. And if you see it, US has this data on influenza. Every year, there is a data in US that 50 to 60,000 people die of influenza. We don't have any data, nor any other country has that data. So even other viral infections are not so innocuous. So that is why we have to build our immunity on a regular basis. It can't be done on a 15-day or 1 week notice. It has to be continuous physical activity, your balanced diet, fresh fruits, fresh vegetables, fluid intake, etc. We must make the healthy living as part of our daily life. And then we can come out of this illness, any illness for that matter, including COVID, much better than others. And that is very, very crucial for our well-being.
Okay, thank you, Dr. Mishra. So yes, living a healthy life and going forward, adopting the tried and tested COVID safety measures of masking and distancing is how we are going to have to tackle this virus. And at a global level, dealing with vaccine inequity. We've actually reached the end of the time. I just wanted to get one closing comment from Abantika. Since both Dr. Mishra and Dr. Rao had mentioned flu, I was wondering, could you tell us a little bit about what kind of other diseases have been suffering because of COVID and their treatments? We know that flu has been, and TB research has been coming down. Over the course of your reporting, have you come across other diseases that are being affected because of COVID cases?
So actually, yeah, TB has been, TB numbers have been quite readily available because it's reported constantly. There's this Mishra portal where TB numbers are reported, and you can see that active case finding has gone down. But in the last 2 years, many things have been neglected. It's not just TB, cardiac issues, because people have just been reluctant to go to hospitals. And there is this fear, not just that, when you stay at home, there are people who live alone. A lot of times when you go and meet people and there are visible changes in your appearance and people say, what has happened to you? Even that was missing. And a lot of cases, I know of very serious patients who got help late because they didn't even realize that they were showing these symptoms. So a lot of things have suffered, cardiac. In fact, we had these reports, though now that the numbers are coming in, it doesn't look like that's the case. Initially, we had reports that all our family planning efforts might have suffered because of this. Our immunization numbers went down a little bit, not as much as we had expected, but they did go down a little bit. So it's not just diseases, even routine health efforts have suffered because we diverted a lot of people for this testing, tracking, tracing business. And we especially in Indian cities, we don't have a dedicated health workforce. That's one of the big lacunae that was exposed during this pandemic. So yes, I mean, a lot of diseases, a lot of patients have suffered during this pandemic.
Abantika, cancer
Yes,
had a
sir.
big beating.
Totally, sir. Totally. The example I used was actually of cancer, a person who was losing weight and he didn't realize because he was not meeting people. So,
Not only that, the surgeries were put on hold. Operations were put on hold.
Right.
Chemotherapy, again, somebody got COVID, can't be given chemotherapy again. So there were a whole lot of issues with cancer therapy, whether it's radiation, whether it's chemotherapy, whether it's surgical therapy of cancer. So cancer was hit very severely because cardiac disease, I would say, unless it's a very clear-cut bypass, I would disregard. But other cardiac, like in children, the congenital heart diseases where that can kill someone, or very urgently required neurosurgical interventions, coma, basically. So that these are there have been whole lot of problems because of the COVID, because everything was concentrated for COVID.
A lot of surgeries were deprioritized, and even patients themselves, I think ultimately in a lot of cases, patients get admitted much later, they get diagnosed much later because they are very hesitant to go to the hospital as well when cases are up.
The physicians were not willing to see and come and treat. A lot of 60 plus were scared to, and we lost a lot of healthcare workforce also during this pandemic because of that. A lot of people contracted the illness and died. So it has actually hit severely the healthcare for other diseases, the COVID.
In fact, it happened on both sides. The healthcare machinery itself, got totally involved in COVID, and people were also not willing to go to the hospitals for other non-COVID cases.
Yeah, exactly.
People dropped annual health checkups. We didn't go for the annual health checkups anymore.
And it is going to take quite a few years to recover from all this impact that COVID has caused. Well, thank you so much, Abantika, of course, but also thank you so much, Dr. Rao and Dr. Mishra, for being with us, for taking time out of your evening to be with us, for answering our audience questions. And also thank you to our viewers for tuning in and asking questions as well. Please do tune in again tomorrow at the same time for our next episode. Thank you.